I want to try one thing. Yeah, feels way better now. First experience was great. Yes, I can't wait to come back.
Or actually, why don't you tell me what's going on?
So, well, I start to feel, I probably say more like headaches in the morning, waking up with discomfort mostly. You know, during the morning, the pain start to getting stronger. But previously, I started feeling like, especially right under my neck, when I lift heavy stuff, like if somebody's putting me like a hot knife over here, especially on my muscle, and then I just have to let it go.
Really?
Yeah.
So it actually affects your arms too?
No, well, my arms are fine. I'm just feeling like a strong pain over here.
Okay, got it.
Yes, but my arms are doing fine.
Got it, okay.
Just like I had to let it go because the pressure is too strong.
Got it, okay.
To handle it sometimes. But recently, that problem, I haven't felt that problem in a long time.
Got it, okay. So where's when you wake up with pain and you get the headaches, where?
So the pain starts from the very bottom, of the skull, and then start to go up, and it feels like somebody's grabbing it from the top, especially here.
How long has that been going on?
I'd probably say a year.
Is it more on one side than the other side?
Yes, this side.
Okay.
The left
side.
one. Yeah.
And the headaches too? Usually a little bit more on the left side?
Well, you start directly from the bottom of the skull. Doesn't matter if it's right or left. You just go like all the way up.
All the way up.
Yeah.
Okay. Anything else?
Yes, and I also feel like a lower back pain, especially when I lay on the bed. I feel like a really high pressure. But now when I'm walking, when I'm like doing the regular stuff.
But it's right when you lie on your back?
Yes.
That's
when
when
I'm
it starts
back.
hurting?
Yes.
Where does it hurt when?
Over here.
Right in the middle. Okay. How long has that been going on?
It started like at least 10 years ago. But now recently the pain is like
not good.
Not good.
Okay. Okay. Do you have any digestive issues too?
Well, recently, depending what I eat and at what time I eat it, it's like really hard for me to digest through the night. The day after I woke up, with this sensation that I'm still full.
Got it.
Of what I ate in the last night.
Got it. Okay. How often do you go to the bathroom? Number two.
Like at least 2-3 times a day.
Oh, okay. Okay. So you're able to like empty out? Or?
Yeah.
Okay. But you still feel full from your meals?
Yeah, so only at nighttime that happen, like nighttime or sometimes in the morning, but not often.
Got it. Okay. You ever feel tired after meals or anything like that? Or any?
What I notice is like I feel like my lungs, I feel them really heavy sometimes.
Really?
Yes. When you run too much, that you feel like you're tired, like your lungs? The same way.
Got it. Okay. So you just don't feel like you can get enough lung capacity? Oxygen?
Yes.
Okay.
Sometimes, yes.
Got it.
But sometimes I think it's like this the job that I do. I'm a server, so I'm standing, like constant movement. So
there's a couple things I'm seeing in your X-rays, but let me analyze you with this first. You've seen this, right? Okay. Okay. We have a reading right there.
I was like, this pain is really hard to handle. The neck pain, when it starts to go all the way up.
It starts here and then it goes up, right?
Yes.
Yeah. Okay. That hurts, right?
Yeah.
Yeah, 0.5. Ooh, that hurts. Does this hurt too, a little bit?
Yes. Yeah. Once in a while, the point where you touch it, I feel like an air bubble. Yeah. Like under my muscle, when I'm breathing, it's really it hurts really strong.
Okay.
Yeah.
So that could be a rib, but also, do you ever feel pain under your left rib cage?
Yes.
Specifically on the left?
Yes.
You might have a pancreatic problem. When you have pain kind of on that side, it's usually a little bit more of a pancreatic problem. Do you have any diabetes that runs in your family?
No, but my grandmother has pancreas cancer.
Oh, she does. Well, let's work on that. Make sure your pancreas has good nerve flow. So, so if you sit all the way back here for me. That hurts a bit, right?
Yeah.
Okay. When you just look up, does that hurt?
Yeah.
It hurts. Okay. Can you look up until it starts hurting? Let me know right when it starts hurting. Not yet.
Not yet. No.
No?
Yeah.
So like right here. You have this reverse curve that's going on here, right? But it's actually, it reverses at the top. You know, when you have something stuck down here, it usually straightens out your neck. But I think you also have something going on over here because that makes it kind of curve backwards, right?
Mm-hmm.
Your skull, and this should actually be parallel, but it's actually going like this.
Mm-hmm.
Okay, so when it diverges like that, usually you have a problem up at the top as well. Thus you kind of getting the pain over here and then cascading up over there too. We have to kind of work on this first. I mean, I know you have the neck pain first. It'll help the cascade not go that way, but we will have to kind of work on that later.
Okay.
So, but not at the same time. I don't want to do it at the same time. Otherwise, we don't know what's working and what's not. The other part that I'm concerned about is that pain that you get on the left side of your rib cage. If you have a problem over there, then you have kind of organ dysfunction too, right? And so then I'm kind of wondering how you're handling sugars, right? How are you handling?
Well, I never did the blood test lately. Well, my mom, she have sugar problems, but mostly it runs on my mom's side.
Do you feel fatigue after meals or?
Oh no, not at all.
Okay.
Not at all. But yeah, the chest pain that you asked me before, yes, once in a while, it's not often. But I would probably say I feel like a pressure over here, but that's very sporadic, not often.
Let's work on what we found today, okay? And then
right.
the last thing is you're really pinched over here in the back too. I mean, you already know that. You're really pinched in the back. That's compressing your disc. That's why it hurts when you wake up in the morning too. So we'll fix that too, okay?
Oh.
Let me have you stand up for me. Can you just, when you go back this way, does that hurt?
Here.
It hurts up there?
Yes.
Okay. Okay, so lean back until you start feeling pain.
No.
Right here?
Yeah.
Okay. Okay. Okay, you can come back. Ready for your first adjustment?
All right.
Okay. Okay. So I'm going to be adjusting your T1. Okay. So you just relax here. Nice. That was good.
Yep. I was not expecting that fast.
I know.
Not ready.
You already watched the videos, so I had to go faster than what you thought in the videos.
Way better, yeah. Before, when I was doing like this, at the moment I was touching, my the pain point, the pain was going all the way up to the head.
Yeah, that's what I mean. It cascades all the way up. So you don't feel that anymore.
Not anymore.
Yeah. Okay. There.
Ooh. Woo. That was good.
That was super good.
Feels definitely way better.
Yeah.
Yeah. I want to try one thing. Yeah, feels way better now. Even like laying down like this.
Did that hurt before? Just
laying down.
Oh, I thought it was just at night. Okay.
No. Just like after like laying down, you can feel also the pressure over there. Nighttime was the worst part.
Got it.
I feel like really well. I can fall asleep like this.
Okay, good night. We'll just film this. Okay. Okay. Well, we got one more to do over here. Can you stand up for me?
Yes, sir. Well, I feel less pain than before. Yes, before I was like feeling like here the pressure a lot. Now I'm still feeling it, but it's more manageable.
Yeah. Okay. So the reason why that's going to take a little bit more time is because, you're basically flopping on this, right? So this is stuck, so it has to these have to compensate. But, once we get this moving, then they just don't have to compensate as much. But it's still going to take some time for it to like fully not compensate.
Gotcha.
Okay. So what we're going to do is have you just relax here and... Woo! That was nice. That was beautiful.
Oh, feels great.
Yeah, that one's important, right? Because as much as we care about pain, we really care about your function.
I can feel like my all my lungs can expand properly now. Yeah. Now before I felt like was all compressed, especially my lungs, even for breathing. Yeah, way
Good.
better. Yeah.
Good.
Yeah.
Good.
It was also giving like a little bit of anxiety, you know, before. Also like couldn't breathe properly. I was like, so I was like trying to compensate, like giving like small breathing during the day, like try to don't like breathe in like full lungs. Now I can feel it. I feel like really well right now.
Nice. Yeah, so what happens is when you have subluxations here, your sympathetic chain and the innervation to your organs is kind of all through here too. So that's kind of what I was saying is, you know, as much as we care about pain, we care way more about your function too, right?
Mm-hmm.
Like your organ function is much more important than
Yeah.
back pain. You know, I mean, as much as back pain sucks,
Yeah.
organ dysfunction is even worse, right? Because that's your health. So, yeah, lung capacity is obviously really important. So
Yeah.
I'm glad you could breathe.
Yeah.
All right, man. Any questions? Hopefully, that's a good first experience
Well,
with chiropractic.
No, I mean the first experience was great. Yes, I can't wait to come back.
Yeah,
Nice to meet you.
nice
Thank
to
you very
meet
much.
Oscar.